So this is for group 24 and we'll be presenting on breast cancer. What is breast cancer? Breast cancer is a disease in which cells in the breast grow uncontrollably, invading healthy tissue in the breast. If breast cancer is not treated, this growth and development of cancerous cells may result in the formation of malignant tumors, which are those that are able to break free from surrounding connective tissue and travel to other sites in the body through blood or lymph, which is known as metastasis. The site they metastasize to are known as secondary sites and include the bone, lungs, brain, and the liver for breast cancer patients. There are also 4 stages of breast cancer which will be discussed. What causes breast cancer? The exact cause is unknown. Although it's been researched, it involves damage to cells' DNA. This damage can occur due to genetic factor, environmental, or a combination. The damaged cells are known to be heterogeneous because they learn how to turn on genes that are beneficial and turn off those that don't benefit them. Like genes involved in apoptosis. Ultimately, it is a heterogeneous behavior that allows them to spread throughout the body via traveling through vessels in the blood and lymph. It's interesting because most cancers are actually caused through mutations we acquire throughout our lives versus a smaller percentage are inherited. Some breast cancer patients inherit mutations of the BRCA1 and 2 gene, which encode a protein that helps orchestrate double-stranded breaks in the DNA. If BRCA1 and 2 mutated genes do not function properly, there's a higher chance that these individuals will gain mutations in their DNA because BRCA1 and 2 won't be able to help repair. Components affected by breast cancer. Breast cancer typically begins in the cells of the milk ducts. This is connected to the lobes and the lobules of the breast. The cells that are located in the lobules function in producing milk in women who are nursing. Breast cancer can also spread and infect individual stromal tissues, which consists of the fatty and fibrous region of the breast. This is made up of connective tissues. Risk factors associated with breast cancer. Some risk factors that are associated with breast cancer are having a family member who are previously diagnosed with breast cancer, which could be in part due to BRCA1 and 2. And then everything listed here: early menstruation, late menopause, and if an individual's lobules and ductal tissues are more dense than their fatty tissues. The stages of breast cancer. Breast cancer can occur in either the lobular or ductal epithelial cells. Most breast cancer is found in the ductal epithelial cells, whereas only 4 to 10% of cases are found in the lobular epithelial cells. Cancer cells that haven't broken the basement membrane and are combined to ductal lobule cells are called pre-invasive lesions. Atypical ductal hyperplasia, abbreviated as ADH, is the initial stage of breast cancer, and affected areas are around 2 millimeters. Hyperplasia means that cells are undergoing abnormal proliferation, and normally DNA repair mechanisms can combat this, but mutations may get through, causing cancer. It only takes one cell to gain enough mutations to cause cancer. When the mammary ducts are nearly filled with cancerous cells, it is called the ductal carcinoma in situ stage, abbreviated as DCIS. When the cancerous cells have broken through the basement membrane and have invaded the surrounding cells, it is characterized as the invasive ductal carcinoma stage. This stage is divided into distinct subtypes based on their growth factor receptors. 5 stages of breast cancer, 0 through 4. Stage 0 is considered non-invasive. This milk ducts are typical site. Abnormal cells are detected. In this stage, cancerous cells have not yet spread into the exterior region of the ducts or lobules. Stages 1 through 4 are all considered invasive. Stage 1, breast cancer can be treated with surgery, radiation, or a combination. Stage 2, it's considered to involve cancerous cells beginning to spread to nearby lymph nodes. Stage 3, tumor size tends to be around 2 to 5 centimeters. Cancerous cells have spread to multiple lymph nodes, breast, skin, or chest wall during this invasive stage, and there are 2 or more treatments typically given in this stage. Stage 4 involves cancerous cells metatastasizing to organs such as the brain, bone, liver, lungs, and there are a variety of treatment options that can prolong life. Prognosis is listed here. In particular, these all tell us more details about the course of the patient's disease. Doctors look at the amount of DNA in the cancerous cells, particularly because of hormone receptors, which can tell how severe the cancer is or not. It's important to note also that a prognosis for one breast cancer patient will never be the same for another. Due to cancer having its heterogeneous nature, it will be very different from patient to patient. Treatment options. There are a variety of treatment options for breast cancer patients, depending on how severe their condition is. A lumpectomy is a surgery option in which only the tumor and a small portion of its surrounding tissue are removed. Mastectomy is all of the breast tissues removed. Both of those can include also the removal of lymph node if needed. Chemotherapy is another treatment, involves many medications, and its purpose is to weaken and eliminate cancerous cells. This procedure may occur during an early invasive stage, so it can remove remaining cancer cells after surgery has taken place. Radiation occurs to destroy cancer cells using a high energy beam. This form of therapy may result in the decrease of bleeding, breathing improvements, and lowering the risk of broken bones that have weakened due to the cancerous cells. It can also remove pain and numbness that may have been caused by pressure of a pinched nerve. Hormonal therapies for cancer patients with hormone receptor positive breast cancer reduce the level of hormone estrogen in the body. An alternative pathway is to block estrogen from forming on the cancerous cells. After surgery, this reduces the early stage of hormone receptor positive breast cancer from occurring. Targeted therapy involves drugs that inhibit the growth of some cancerous cells. It would be beneficial if the growth of an abnormal protein, for example HER2, was inhibited, since this protein stimulates the growth of cancerous cells in the breast. There's also immunotherapy, which is still on the rise and utilizes the immune system to fight cancer. And this will be discussed in subsequent slides below.